Hello there, I'm Jen from Actual Doctor ASMR. I'm a real doctor, and I'm here to tell you how to do the cranial nerve exam properly, because y'all are doing it wrong and it's giving me an aneurysm every time I see y'all's videos. Do 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 bump. I'm sorry. I'm sorry. I promise I'm not going to be a jerk. Another thing I wanted to mention today is most doctors who would do a cranial nerve exam in an outpatient visit would not wear a white coat. No, white coats carry germs. They are the dirtiest item that a physician can wear. Physicians in, so I'm going to take this off because I'm also sweaty up in here. So, ow. So, physicians in hospitals who do, like specifically hospitalists, will wear white coats so that they can keep their scrubs clean, but those white coats are literally white coats from inside the hospital that they will wash and scrub, okay? And that are washed and laundered regularly by the hospital, or supposed to be in real life. That never... Anyway. So, in real life, a white coat is the dirtiest thing you would ever have, and the kind of physicians that you see, my dear, that you have something on your face, my dear, the kind of physicians that y'all are pretending to be in an outpatient visit, where you would do a cranial nerve exam on somebody because you're trying to figure out broadly what might be going on with them, so you can send them to a neurologist. So you can send them to a neurologist. You would not wear a white coat. You would not. If you did, it would be because you were outdated and trying to look cool. And there is something to be said for looking cool. There is a certain amount of patient trust that you can build by fulfilling expectations, such as a white coat. However, if y'all are going for accuracy, disclaimer time. So while I am a physician who has dots all over her face for some reason, so while I am an actual physician, I am running out of battery, and everything that I say is not actual medical advice to diagnose or treat any of your diseases, and you may find that some things are different, that there are amendments in the way things are being done as new studies come out. The Bates Physical Exam Guide is a guide that you should get if you're an ASMR artist and want to do medical exams really correctly. Or y'all can go on giving me an aneurysm, it doesn't matter. I guess if you get in the videos, it doesn't matter. But on the other hand, there are medical ASMR videos out there that actually promote some misunderstandings, and I know you don't intend to do that, but the people who listen to you, there are smart people who listen to you, and there are dumb people who listen to you, and you can hurt the dumb people who listen to you by giving them misinformation. I don't know if that was the most tactful way to say this. This is the blunt thing, because this isn't a role play. This is me. Yes, in real life I'm very nasty. But in all seriousness, I'm gonna have to go get a cord. We'll see. We'll see if I can knock this out in 10 minutes. Let's go through the physical exam, and we'll that'll be helpful. Okay, so cranial nerve 1, sometimes I see y'all trying to test it because it is smell. In real life, you would never, ever test this. I tested it, we did it, we learned it back in our OSCEs in medical school and never used it ever again. There is evidence that the Wilderness Medicine Society talked about in one of the recent WMS podcasts that you can use it for very high-level athletes when they're out in the... If you are the physician for a high-level athlete in an ultra marathon, and then you wouldn't be with a clinic green screen, then you're out in some woods. And you might have somebody who you're trying to see if they have altered mental status or if they're just exhausted from their work. Okay, they could just be exhausted. But if they have altered mental status, right, you might use that to see if they have early signs of brain damage. Otherwise, never, ever, testing sense of smell is not very realistic, and it's silly and funny. You can do that. That's fine. I think it'd be neat to see a worst cranial nerve exam from JoJo ASMR where all you do is test sense and smell. But yes, cranial nerve number 2, and these are numbered by where they're located in your, like if I wanted to die, sorry, it's morbid. So at the where your brain stem starts to go down into your spinal cord, the nerves in your head connect there, and they connect separately and specially and differently from the nerves of the rest of your sensory system coming on the way up. Okay, and that's why they're special. Okay, because they have those special. We test them specially because they can tell us that particular things are going on. Okay, and because the nerves of your head, those senses are very important to you. So 2 is sight. You can do the full eye exam, technically, to test sight. That would be like your optometrist role play exam, and y'all know probably more about that than I do because I'm not an optometrist. I'm a physician. You should also know the difference between an optometrist and an ophthalmologist. An optometrist is not a physician. That's also a misunderstanding. They are an eye expert that helps fit you for glasses and so forth. They know more about vision than I do, but they are not a physician. They did not go to medical school. An ophthalmologist is a physician who not only went to medical school but went to an additional surgical specialty after that. They can cut eyes. Okay. They are very talented, and that's where I send people if I'm worried that there's something wrong with someone's eye that might need surgical management. Okay. There's a lot of primary care stuff that I should be able to do as a provider. But obviously if I don't know something, ophthalmologist. Okay. So that's cranial nerve 2. You can use, there's an app on the phone that we kind of learned about during medical school that actually has a good eye exam that works. It's adapted for 4 feet instead of the chart, the Snellen chart from far away. You can look up Snellen app. However, I did see a study, and I don't know where it is, so I'm not going to link to it, but you know how to PubMed.gov if you've been watching my videos. There is some evidence that that is not a particularly useful chart, the little phone chart, that there's some user inaccuracy, so it may not be as good as the chart on the wall. So you can get a chart on the wall, and I know this is a green screen, and no, I'm not going to replace it and put an actual chart. Ha ha ha. You'll have to use your imagination and imagine that there is a chart on this wall. So, chart on the wall. So the Snellen chart is a great way to test that. If I'm in a hurry, and I'm just trying to make sure that I'm doing a rough check, our soldiers get eye exams every year, so I don't need to do a whole new eye exam every time I do a cranial nerve exam. So in real life, I will point to the name tape on my uniform. I will ask them if they can see this letter from about 4 feet away. Just a basic, like, vision grossly intact is what we would note, was what a physician would note in their note. So you can do something like that instead of doing a full eye test. You can do like, hey, can you tell me what number this is? And yes, I'm gonna touch the shit out of my nose because it's not a role play right now. So that's cranial nerve 2. Cranial nerves 3, 4, and 6 are the ones that we test when I make the Benedictine monk sign. Traditionally, people use an H, but it's easier for me. It doesn't matter. What you need to be testing is their vision going all the way out here, going all the way out here, and eye also all the way down, all the way out, all the way out. Okay? Because that's testing the different, there's a couple different muscles, and we can go into them in depth if you want, but for now I'm trying to make sure that I beat the dying battery of my computer. 3, 4, and 6. Okay, each one matches to a muscle. These ones are blinking is actually also part of that. There is a branch of one of those cranial nerves that is affected by blinking. 3, actually, specifically 3 also controls whether the pupils dilate. So an important part of any neurological check, not just a full cranial nerve exam, is going to be checking if the pupils dilate when you put light on. The computer died. Okay, well maybe we can still do like this. Can you hear me? Are you happy with what you hear? Computer. Oh man. Okay. So that's that. I'm annoyed because right now my brain is like buzzing through. Oh no, the audio is going to be lower quality now. I should stop and get the charger, or I could keep going and make sure that I'm still in the same train of thought and I don't like plunge into depression between walking here and over to the, it's a bad depression day. Just plunge into inactivity between here and getting the cord. That's what I'm thinking. Are we going to actually finish and upload this video? Or are we going to wait and try to make sure we get this particular kind of audio? We might not be able to. It's terrible. Let's compromise and let me plug in. Nah, let's not compromise. Let's go one or the other. I'm staying here with you. How do you feel about that? Your hair looks lovely today, by the way. I don't know if you can hear me brushing through your hair. I hope you can. But it looks lovely. So that was 3, 4, and 6. And what you do is you shine a light. When you're shining the light, you're not just shining a light in the person's eyes. What you're trying to do is you're trying to see, when you put the light in the eye, does the pupil constrict? That means, does it get little? You want to see it get little. And when you take the light away, the pupil should get big. The reason we do it a second time, and you think that we're doing it many times, we really only do it twice. Maybe 4 times, depending on how well we can see. The second time that we do it, we're checking the other eye. So I might shine in this eye. I'm trying to see if when this eye gets hit by highlight, does this constrict like it's supposed to? Because they're supposed to work together. It's supposed to be that when I shine in this eye on the one side, the other side constricts because they're buddies, they're friends. They go through everything together. Okay? Roger? All right. So that's why we do that. And that's why you might have 1, 2, 3, 4. Or a very observant practitioner might just do 1, because they will see that this one is doing and this one is seeing, I'm not that fast, I have to do double. And 1, 2 on the other side. Okay? 1 and 1. I don't know why you do 3. Whatever. So those are cranial nerves 1, 2, 3, 4, and 6. But Jen, you might say, why, Jen, did you skip number 5? Is it because in medical school they taught you how to not know how to count? Or is it because you're crazy? To which I will answer, honey, yes. No, actually. So cranial nerve 5 is a super cool nerve. It's called the trigeminal nerve. That's the one that's responsible sometimes for things like trigeminal neuralgia, or when you have that lock jaw, when you have the when you have people. Nerve, the fifth cranial nerve, the trigeminal nerve, is called that because it does this across your face. It has these branches, V1, V2, and V3. V being the Roman numeral 5, because we are still affected permanently by Roman colonialism. Technically not colonialism, technically imperialism. Here. Okay. And that's why I will say, does this feel the same on both sides in a quick exam? In an exam where I'm not sure that the patient is reliable, or I'm not sure that the patient knows if it feels the same on both sides, I will have them close their eyes, or just or here's another setting, so that I'm not making assumptions about the patient. If I am concerned, and the patient has brought to me a concern that sounds like it has something to do with nerve 5, like they have some kind of numbness in their face that they talk about, then I will take a longer time on that. The entire cranial nerve exam is not supposed to be a big, long out, hour-long video thing. It's supposed to be a couple minutes part of the entire neurological exam, which should only take you 2 to 5 minutes complete. There is a complete template somewhere out there where an experienced physician demonstrates, like, you can do the entire thing completely, not crappily and rushed, completely in 2 to 5 minutes. I think there's a guy who does like a 60-second one. Still hitting everything that's in that Bates book that I mentioned. The Bates Physical Exam Pocket Guide is going to be the best thing if you want to have accurate or realistic medical exams for your stuff. Although, yeah, sorry. I got distracted thinking about how angry this particular Reddit is making me lately, because there's a Reddit that is called Medical ASMR. I'm a physician. They do not like me there, even though I'm the only physician posting this up. Whatever. And I like to be liked. And it's like, do you not... The name of your sub is Medical ASMR. You need to... Whatever. Anyway. Cranial nerve 5. What were we saying about it? Oh, the entire cranial nerve exam. We were saying two things and we snowballed out. We're going to snowball back in. Okay, snowballing back in. Because we had a bunch of parentheses. We're going to close the one parentheses and close the other parentheses. To close the one outer parentheses. The cranial nerve exam is supposed to not be a really long thing, because the idea is that I'm going to find a smaller thing and I'm going to drill down into that particular area if the patient has a problem in that particular area. So, for example, I'm doing the cranial nerve exam and something is kind of wonky with the face, with something in one of the nerves of the face, right? 5, maybe 8 or 9, something like that. Okay. So when that, if that happens, then I drill down into that area and I do a deeper examination in that part. People ask about doing a full physical exam video. Honey, if you were to incorporate the full physical exams of every specialty, it could be, I don't know, you could be there forever and ever and ever, especially because everybody has their own. There are a lot of people who have their own, like, extra little things that they've learned that help them define things. The idea of a focused physical exam is that, okay, maybe you are getting a kind of head to toe of all systems. That can happen.
Hello, sweet one. I hope that you are enjoying this video. I wanted to invite you to join my secret agent digest that is linked in the description below. The Secret Agent Digest Relaxation Group is a special club for people who enjoy ASMR and relaxation, whether you get the tingles or not. It will weekly send you ASMR video suggestions that YouTube might have missed because they are smaller channels that I have found and hunted. I have found over 200 ASMR channels from which I can find videos to suggest and to share with you. There may be some cool things from big channels that you've missed too, either because they're older or just because. And of course, I will always link to the videos that I've made that week so that you don't miss them. It's kind of like hitting the bell, except you also get everybody else's videos, plus you also get little relaxation tips in real life, plus you also get to look at cool tingly stuff that may be ASMR inducing outside of videos and YouTube. I will send you a note about what is going on in the relaxation world today. And that is just one email once a week. Plus, I will send you exclusive access to neat little things, kind of like t-shirts and little quotes and neat pithy little things that are good for your relaxation. The Relaxation Digest is basically like a Patreon with all kinds of cool rewards, except ding 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 ding. It is completely free. Yep, that's right. It is free to be on the Relaxation Digest, discover cool things, and not lose contact with me. If for some reason I disappear from YouTube, which could happen, I am occasionally offensive. If for some reason I disappear from YouTube, the Relaxation Digest means you would still be able to contact me, hear from me, and get neat audio. Basically, it's the best, and I will be offering neat things on it. So, definitely check that out in the description below. Alright, I'm waiting. Don't worry, we'll get back to the video. Okay, bye-bye.
It's not a focused exam anymore. Maybe do a full head to toe of all systems. But the goal is to find the thing that's in a normal checkup. You're going to have more benefit talking and listening to the person and hearing about their problems in a routine check in a healthy person where they're like, I want my yearly physical. Yes, there's going to be a couple systems that you check as a whole, but listening to the person's problems rather than assuming that you're going to magically find something in a totally healthy person, and listening to the evidence-based guidelines, like, okay, at this age, this woman is at risk for this. At 40 years old, you know, is she gonna, well, at 50 now, although it's different. Anyway, there's colon cancer screening age, there's mammography age, there's an age in which everybody should get a yearly EKG, yearly lipid panel. All depends on your age, and that's important to check on the age and listen to the person's health, how they're doing with their social life, how they're doing with their nutrition, how they're doing with their exercise. You got to do that. The physical exam, you can do a full physical in about 5 minutes, like 5 or 6 systems. So the real, like, in-depth drill parts that really take a long time are when you're drilling down to try to find something. So similarly, I was saying the cranial nerve exam, what you're doing is you're looking for red flag signs and then you're moving on to the next thing, right? However, if I am zooming in on the trigeminal nerve, so if you want to incorporate a zoomed in feature and you want to do this, and what I used to do, I used to never do this, by the way. It's not a very accurate technique. It's just, okay, we're making sure, you know, no general problems. But in real life, somebody coming into me with some kind of complaint, and I want to zoom in on that and check on that. What I will do is I will have them close their eyes. And this is another reason that I don't do this all the time, is because in my military population, sometimes they're uncomfortable with closing their eyes. So I'm not going to make someone do that unless I, need to. So I'm having them close their eyes, and I'm going to touch here, and I'm going to ask them to point and tell me where they feel it. I'm going to touch here, I'm going to ask them to point and tell me where they feel it. Here, not in that order necessarily, because then y'all will cheat, but making sure I get all 6 points. Because this and this are different branches from this and this, which are different branches from this and this. Okay? So those are, that's nerve 5. Okay? We already got 6. So 7 and 8 are related because they run right next to each other. But the facial nerve and the buccal, more stuff on your face, it's bothering me. Why you come here with this dirty ass face? Like, what's your deal? Do you know what I'm doing when I say that there's something on your face? No? It shall be my secret. So anyway, nerves 7 and 8, not in that order. I will check. What I want to check is the musculature of the face, and I want to check your hearing. So 5 is the sensory of the face, but the motor function of the face, I will check by asking them to smile or puff out their cheeks, or I will ask them to wrinkle their foreheads, right? Or squeeze their eyes shut, okay? Make a kiss face. I don't usually do that in ASMR videos because we're already highly sexualized, and the minute I make a kiss face is the minute I'm gonna get more spammy comments, like the one that asked me for my eyebrow face. Screw you guys, like, for real. My hatred knows no limits. But in all seriousness, sorry, I got distracted. And 7 and 8 run close to each other, and it is also easy, which is why you can have muscle jaw. Like if you have TMJ, that's what I was trying to remember earlier. That's how people call it, the slang term the cool kids are saying these days. If you have TMJ, you sometimes have hearing problems or tinnitus because that musculature runs along a similar place that the hearing nerve runs, which is why sometimes I will get 7 and 8 mixed up and put them out of order. I don't think I've done it in a video. We're not out of order because it doesn't matter what order you do these in as long as you get them all I do them in a similar numerical order, because that way I can remember them. But I will actually forget which one, like, wait, 7 or 8, sometimes I'll swap. Anyway, so to check that hearing is grossly intact, to do a full hearing test, you need to go to an audiologist. You need to hear the stupid little beep beep beeps that I have to hear every year. Oh my goodness. My hearing test this year was torture. It was torture. And then because it was inconclusive, they made me come back and do it again. And I say it was torture because with my chronic pain on the little stool, kind of like how I'm very uncomfortable right now, on the little stool, it was just a day I was having a flare. Shouldn't have been a problem, but it was a problem. I was sitting on that little stool and I was just like, oh, let me out of here. Let me out of here. I can't move. Let me out of here. Let me out of here. It was like so uncomfortable. So the second hearing test I just did standing up the entire time. That was better. With much less back pain. It wasn't that much better. I still felt terrible. I was like leaning against the wall and it was awful. Couldn't hear for shit because I was busy. Sorry. I was busy being very uncomfortable. There's so much stuff on your face. You just, I don't know how you expect to learn with stuff all over your face. I just said I wouldn't do it and I did it. But as you're so cute, you're so dang cute, I just have to do that. And then I put myself at risk of people being dumb in the comments. It's not my fault. I should be allowed to make whatever faces I want without dumb things in the comments. Y'all lady ASMRists know what I'm talking about. I would say y'all boys like the thirsty, but that is not true always. I don't want to make assumptions. You should be treated fairly too. Harassment is harassment, even if it's against a boy. Alright, I'm gonna sit on this pillow. I can't do this anymore. Alright, so as I was saying, nerves 7 and 8 are kind of connected. When we are saying that hearing is grossly intact, what I am saying is that your hearing is, if I do this on this side, if I do this on this side, next to your ear, oh, I love that sound, don't you? If I do that hearing sound on both sides, that you can hear it out here. And in a quiet room, you should be able to hear it all the way out here. Okay, all the way out here. So I will ask them when they hear it. If they don't hear it until like here, I'm kind of like, okay. And of course, if they don't hear it till like here, we have some hearing loss. Okay. And if they don't hear it at all, I'll then send you to an audiologist. So hearing grossly intact, that's a quick test that they can hear it. Oh, speaking of which, one way to test too, really quickly, you've seen this. This is a real thing that people do, this peripheral nerve thing, this peripheral vision thing. What you want to do is you want to start behind their head, like this. So say you're doing it to me. What if you're doing it like this? These are your hands. I don't know how to make it look like these are your hands. These are your hands choking me. So I am going to do a video where you get to do things. Like you're going to have hands. It's going to be my hands. I'm going to use the green screen and there's going to be 2 knees. It's going to be fantastic. Because the more me, the better. That video is not this video though. But you know what I mean? I'm doing like this. I'm behind your head. And I'm pulling it forward, pulling it forward. Okay. And then when you see it in the very corner of your eye, on both sides, and I'm touching my nose, there's nothing you can do about it. When I see you on the corner of when you see my fingers in the corner of your eye and tell me to stop, that's when you stop. It should be about here. But they can't look to the side like that, that's cheating. About here is actually normal. So right where your ears are, you should be able to see it at your ears. If it takes after your ears to see it in peripheral vision, honey, you're at risk for a lion eating you. My favorite thing during these videos, and some of you have been doing ASMR much longer, my favorite thing is the moment I get to pause and say, like you're talking to me. Yeah, I love that. Where were we? 7 and 8. Okay, so we've got 7 and 8. Now we just need 9, 10, 11, and 12. 9 and 10, you check the same way. You have them open their mouth and say ah, and when they do that, and y'all better not be thinking or saying nasty things. I'm giving you education right now. Education. I'm gonna open my mouth and you're gonna look and pay attention. You're gonna learn. Okay, you're not gonna be nasty. So ah, ah, ah. The reason I'm saying ah, and the reason I have you guys say ah, is because I want to see the back of the throat and the uvula. For a second, you got to see my uvula. I have a terrible Mullen body, so you like can't see at all, but you did. I know you saw my uvula for just a second. The uvula should go up and down. It shouldn't go this way or that way. Now, in a as I learned as a young medical student, sometimes we'll see a uvula that's long and like sticks to one side. It's like the bottom comes around. That's not a problem. Sometimes people have funny slime and that's how they are. But the base of the uvula should move up and down symmetrically. And you'll see if it's a short uvula and it like is going to one side or the other. That's not good. That means that there's nerve damage on one side or the other. There's a bunch of more advanced stuff that gives us all headaches in medical schools we try to memorize because the cranial nerves. So there's some sensory nerves in the body that cross over and others that do not. So, for example, if you have a nerve lesion, if you lose sensation on this side of your body, or sometimes where you lose sensation, the opposite side of your brain is the place that's affected, and sometimes it's not. We'll say like that the tongue will point towards or away from the site that it's injured is what we think about. Yeah. So, which reminds me of the doctors have funny and terrible jokes too. We also have a joke about when we're reading an X-ray, and I can't remember if it's the Tracy Johnson sign or what it is. It's kind of funny. It's got a name. It's got a man's name, and it's about where the male anatomy is pointing to. And if the male anatomy is pointing towards the area where somebody had a break, then it's a positive sign. It has no clinical relevance whatsoever. It's just it's pointing one way, because doctors are not more mature than anybody else. We just pretend we are, which is why we use very fancy words for poop, unlike you people. We talk about poop all the time, but we use fancy words, and therefore that's okay. You might get 100, like we will be sitting around, the table, and we will talk about, whether or not somebody had blood in their stool, and none of us will feel weird while we're eating. Other people would. But because we say, yes, we did a fecal sphere and an anal exam, a rectal exam. We would never say anal exam because that sounds weird. That sounds not normal. We did an anoscopy, and it was blah, 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 blah. And we could talk about butts forever. And, we don't feel ashamed because we're using fancy words. But if you were to say, yo, he has some blood in his poop, then the other doctors would look at you. At least for a little bit, depending on where you are, how high society they are, whatever. Medicine is full of hypocrisy. Anyway, parentheses back. Doctors are immature, and parentheses back, things point different ways sometimes. What you need to know is that the uvula should go straight up and down. If it doesn't, a neurologist needs to look at that. Okay, and because both nerves 9 and 10 help control that, that's a really easy, quick check to see. Also the palate, I don't know if you saw, but my palate, which is the roof of my mouth, the back of it went up versus down. Okay, when I said ah, that's why when you go to the doctor and you just open your mouth wide and we're like, please say ah, mother, please say ah. It's the biggest pain in the world when I'm like, I need you to actually say ah when I say ah. I'm not just saying that to be, juvenile and be like, say ah, just to get you to open your mouth, because you're probably too stupid to open your mouth if I say open your mouth. Say ah. I want a meme like, say ah, motherfucker. Excuse me. I'm so sorry. You didn't hear anything. I said motherfudger. That is what I said. I was very, very respectful. I think my mom no longer watches these, so I think I'm good. She was doing it at first to be supportive, and so she was commenting on all the things. But whispering drives her crazy, and I prefer whispering. So she gone. Alright, so that's cranial nerves 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I do 12 next because it has to do with the mouth. So ask them this, or I'll do 12 when I do 7 and 8. Have them stick out their tongue and move it from side to side. That is testing the hypoglossal nerve. There's other stuff you can do to test the vagus nerve, which is 10, which is probably the most important or like most famous nerve in the body, because it's the cranial nerve that then continues all the way down your body and affects your breathing rate. It affects so many things. Oh, I hate it when this stupid phone does maximum file size reached. And I don't know what's gonna be deleted. So discouraging. Nerve 10 is a pretty sweet nerve. There's some pain signals, efferents that go into it too. Sorry, efferents. Yeah, there are some sensory nerves that wind their way up. And then, so 10 and 11 and 12. So 12. 11 is a weird one because 11 is already so far down, it goes down into your shoulders. And it helps you do this. So I asked them to do that against my hands. I'll put my hands on their shoulders and have them do that. Okay. So, that is the actual cranial nerve exam, which doesn't take as long to do as it does to explain. And I am going to be uploading a video about a medical exam after time travel, but I have to think a little bit more about what kind of medical effects, side effects time travel might have. So I also uploaded a video about where the doctor is giving you an eye exam and then goes away to play video games. That's pretty silly and fun, so you could check that out. And I think there was some there keeps being housekeeping that I want to do, and then I keep forgetting to do it every single video, so. But I thought that this could be maybe a little helpful, if not extremely insulting, but hey. I got banned from the alternative medicine Reddit, and I am convinced that it is because I'm a physician, because there's no other physicians there, and there's a lot of like energy healing stuff and things, and I like alternative medicine when it's evidence-based, and so I like to share evidence-based medicine things, because there are evidence-based herbals and so forth. People are very like easily offended. I can be far more offensive than I am on YouTube. But these days, everyone is offended by something. Even saying these days, that's gonna get me labeled, because it's like, oh, you must be one of those people who doesn't believe in women's rights because you think that we're going backwards instead of forwards. But you must have voted for so-and-so. Like, y'all have too much time on your hands that you can get offended over every little thing. Wait till you've held some dead babies, and then you'll be offended by different stuff. I am more offended by some things now. Alright, I hope that was helpful. I hope that cranial nerve exam was helpful to you, and I hope that y'all stop driving me insane with your terrible cranial nerve exams. Or continue. I don't care. I'm not going to be offended. I do think that you should be careful, because you are content creators to the point that people listen to you while they're sleeping. So like, you are affecting what they hear as they fall asleep. That you are incredibly suggestible at certain periods of your dozingness. In certain periods of less wakefulness, you are incredibly suggestible. So if you are whispering to somebody as they're falling asleep, I don't know, that your ear controls your elbow, and that if you rub this herb on their ear, their elbow will get better, then the next time some quack comes along to tell them that, they're going to believe it. I'm not saying universally you don't have to be, you don't have to care about what I'm saying, and it could be that I'm placing a great responsibility on you as content creators. But I have heard a number, even of larger ASM artists, like giving medical advice or psychological advice, like that doesn't necessarily have its roots in evidence, and that's. I am 100% guaranteed that 10 years from now, something that I have said in a video will no longer be evidence-based or true. But the least you can do is try to look things up beforehand now and use the best evidence you have now. I don't blame, people sometimes blame the old days doctors who like bled people and stuff. I don't blame them. They were working off the evidence that they had to some extent. I'm like, you really thought the Greek humor thing worked? And insert here long rant about how the fact that Galileo, it wasn't the Catholic Bible that was against anything Galileo said. It was Aristotle's theories of the earth that the Catholic Church had decided was important because they were the keepers of science. Not understanding that it's like the keepers of science can be as dogmatic as the keepers of religion. So what am I saying? So I'm saying that to some extent, no, screw you. You shouldn't be bleeding people to make them better. To some other extent, if you're working with the best knowledge you have in the day, and the best knowledge you have is that, hey, this guy seemed to get better after I did this, I understand that. So what I'm saying is you have a bigger responsibility because you live in the age of the internet. You do not live in the age where you had to figure everything out on your own, and then maybe later a dictionary or an encyclopedia involved, or maybe you had to apprentice someone to learn knowledge. You live in the age where you can freaking look stuff up. You can go on PubMed.gov, you can go on Medscape and make an account, lie and say you're a doctor, you'll still get a free account on Medscape. You can get a free account on Medscape and get access to all the stuff that only doctors get. Just say you're a doctor. Did I have to put in my medical school to get access to that? Put in my medical school. You can make an account. Say you're a nurse. Say you're a nurse instead. But you can get a Medscape account and you can get like real medical information that people use. And you can look up, no matter who you are, you can look up studies for free on PubMed. Maybe you can't read the full article, which would be ideal if you can read the full study. Maybe you can just read the abstract. Sometimes that's all we have time for anyway. There's a running joke about how you have another thing on your face, my dear. And look at my awesome white hair. Oh no, that's not my white hair, that's my forehead. I have one white hair somewhere up in here. It just appeared this year on my deployment. It's gorgeous, it's somewhere. There's a running joke about how physicians we don't see things, or we don't look at. There's a running joke that medical students read a certain part of a research study. Physicians, like attendings, read like the title. Residents read the paper, and then like before that, people read the abstract. Like it goes by year. What people read. It's just not true. But anyway, you might not have access to the full text. Read the abstract. Do your best with what you can. But do your best. Like look up, if you're gonna say like that this herb works wonders, look and see if there's actual studies for that herb, and not just by Googling it. Google can be helpful sometimes. But by looking on PubMed and getting, the actual repository of stuff, actual repository of medical knowledge, Dynamed and UpToDate or other resources, but I think they're only available for physicians. PubMed is freely available to everyone. So, if you're gonna say if you're gonna say that something works, and if you're gonna say that something doesn't work, like some people unilaterally are like, I hate chiropractor is always wrong. Chiropractic, I'm sorry. And I will say that it is possible to hurt someone as a chiropractor. I am not a chiropractor, but I do practice some forms of medicine that are similar to chiropractic that do have evidence for them. OMT uses some chiropractic techniques. Chiropractic actually evolved. This is where knowing history is important. I always say knowing history is important. Chiropractic became a field of thought around the time when, just before medical schools were becoming standardized, and a medical student at a DO medical school, or a medical student at an osteopathic medical school, where they learn everything that an MD like me learns, but they also learn osteopathy. He decided he didn't want to learn any of that other stuff. All he wanted to do was crack backs. He didn't want to do the rest of medicine. Okay? That is what happened. You can look it up, the history of chiropractic. He left and he wanted to do chiropractic schools. Then, when they were standardizing the schools, the DOs said, sure, we'll play along. We will maintain the same standards that the MDs do. And the chiropractors said, F you, we're going to do what we want. We just want to crack backs. So because of that history, there is a history of rejecting evidence among certain chiropractic schools of thought. However, that said, some of the best healers in the nation are chiropractors, and I'm not ashamed to say that. You know it. You have a friend somewhere who swears that they're best, that they feel so much better after going to the chiropractor. A good chiropractor can do a lot of things, and there is evidence for HVLA, which is the technique that chiropractors use. They just don't call it that. You have so much stuff on your face. Oh my goodness. You're just covered in mud, my dear. There is some evidence for some of the things they do. However, some of the things are very difficult to test and prove, because how do you do fake chiropractic, right? How do you do a placebo so that you can really check? So, I say all that to say it is difficult to say unilaterally this is fake. It is difficult to say unilaterally this is good. You have to look at the specific evidence behind specific techniques. A good chiropractor, just like every evidence-based healer, is going to study each technique that he uses, or at least each group of techniques, and see which ones have the most evidence for it. I've read studies on the soft myofascial techniques that people use in OMT, and they're soft studies. They're not the wonderful randomized controlled trials like I talked about in my video where we debunked the Time magazine thing. We didn't debunk them. We discussed them. We were kind and polite. I talked about how there's different grades of research evidence. The trial that I saw wasn't like the highest grade of evidence. Still, it was something. It was some evidence. Yeah. When you're making claims in your videos as a content creator who, some of you, hundreds of thousands of people are listening to, I don't think any of you people are going to see me, but maybe some of you smaller people will before you become enormous and huge. And you need to be careful what medical stuff you're saying, and if at least try to discuss the evidence or cite your sources or something. I know I don't cite every single source. I try to cite most of my sources, and if not, I will try to tell you based on my experience as a physician, right? Before I was a physician, I cited every single thing. I didn't say based on my experience. I didn't say, and if you're going to cite your experience, it better be a very particular experience. It better be, hey, this worked for my aunt. This herb worked for my aunt. That is what we call anecdotal evidence. It is called a case study, and it is a kind of evidence, okay? Be specific. Don't be like, this is great and wonderful, and we all believe it because we believe it. Okay? Don't be woo. And who am I to tell you what to do? I'm just saying, I have a very high opinion of you, and because I have a high opinion of you, I expect and hope a lot from you. Also, I'm a dick, and I like making fun of you and bothering you and poke. This is not how you punch, by the way. I know that. I'm not punching. I would never. I had a black belt in Taekwondo many years ago, and I would never ever punch like that. So please don't judge my punches. Don't make no meme out of them. Okay. And I say had because my striking skills are shit now. Oh, I said such a naughty word. Let's see if Mom saw. Have a lovely, lovely night. I'm sure this wasn't restful at all. Maybe it gave you some